Hey everyone, it's your MPP Dolly Begum for Scarborough Southwest. I am so pleased to be back here with you today on another town hall. And this one is on workers' rights and having a conversation with my friend Jared Ong, who's joining me today. As you know, this week we've been doing a lot of work, whether it's working with essential workers, working with our seniors, working on some of the issues of education. And we know that during this difficult time, workers across Scarborough Southwest, across Scarborough really, a lot of whom are essential workers don't have the ability to stay home, who are having to go out, take public transit, go to workplaces where they may not feel safe, risk their lives, their family members, just to put food on the table. So here we thought, why not have a conversation about some of the rights that you have, what rights your employers have, and if you have any questions, we can answer those. So this evening, we are going to do just that. And I have with me my friend Jared Ong, who's joining me today. Jared is a community organizer and caseworker with the Workers Action Center, working on the front lines, empowering workers to stand up for their rights at work. He sees every day how our labor laws are insufficient to protect workers' rights. He believes that Band-Aid solutions aren't enough to address systemic inequality and therefore works to build collective power, one community at a time. I am so glad to have Jared with me today. He's also a wonderful photographer, wonderful community organizer, and has been fighting hard for workers across this province for a while now and has a lot of experience working closely with essential workers during this pandemic as well. So welcome, Jared. Thank you so much for joining us.
Hi there. So my name is Jared. I'm an organizer of the Workers Action Center. Just a bit more about the work that we do here. We're based in Toronto, but we help folks across Ontario. We provide a hotline Monday to Friday where we answer confidentially and support workers facing any issues at work, whether it's unpaid wages, whether it's health and safety questions, whether it's questions around termination and what they're going to do about it. And regardless of your immigration status, regardless whether you're part-time, full-time, contract, or union, regardless of your income level, we do provide the support. And we have actually switched to doing a lot of these things online during COVID, which I find kind of useful too, because originally we were doing a lot of the Ministry of Labor claims and EI applications in person, but then that prevented us from helping folks outside the GTA. So we've actually had people from like Ottawa and Hamilton. So looking at the bright side of COVID-19, work from home, digital life, I guess. And as much as we help folks individually, one-on-one through Ministry of Labor claims, we are very aware that, as much as you can help all the individual situations, very often it is systemic issues. Very often labor laws are not strong enough to protect us. And that's why we also are strong advocates for improving the floor of the Employment Standards Act. And I'm so glad to have the opportunity to talk to some folks today to know about our rights and maybe fight a bit more for them.
Thank you so much. Yeah, absolutely. And I think you're right. I think that the digital world has made it easier for us to have you join us from the from a different place, and a lot of workers are now able to have really good information as well on that end.
I do miss real life town halls with samosas and drinks and stuff. It's like I do miss those in-person town halls. Not gonna lie, New Year's levy,
We had our New Year's levy virtually, and it wasn't the same, I have to admit. I also know that I miss samosas. They're one of the best parts about these organizing meetings. And I know many of the workers in Scarborough, many of the organizers, legal aid events, a lot of those ones that we used to do, samosas were always a valuable part of it. And the other thing that I think has also been really important is during this time, we know a lot of people don't have access to internet or a computer to be able to get on a Zoom call and do this kind of information sessions, or have access to a legal aid personnel, for example. And legal aid was a big issue when it comes to the funding cut and the amount of support that legal aid can provide, right? And this is something that you guys have noticed in your work and the volume of work that has come in.
Yep.
So what we'll do is, you told us a little bit about Workers Action Center. Do you want to share in terms of what kind of support you have available through Workers Action Center and what people can reach out to your organization about?
Yeah, so if we kind of we're focused on employment standard questions. So basically that's very broad, a question about your rights at work, anything from you're not being paid properly, or you're being harassed at work, or you're not sure about your health and safety, like anything around those things, you can give us a call at the Workers Action Center, or send me an email. In fact, Dolly can give out my email, I don't mind. And we are happy to answer these questions, as well as if your rights are being infringed and violated, we do help folks file Ministry of Labor claims, which are entirely free. It's not a fancy pants process where you have to go to like a judge, a lawyer, and everything. It is scary though. And so we do help workers feel like empowered to be able to stand up against their employer. Because it is a scary process, especially if it's a job that you need to keep, whether to keep paying rent or whether your job is tied to your immigration status.
Yeah. And what we'll do is we'll make sure that we give the contact information for folks. We actually had over 100 people, I think 100 and something, I forget the exact number of people who signed up to tune in today. So I'm really excited. Welcome to everyone. And for those of you who are just tuning in, welcome. Thank you very much. Please feel free to leave a comment on the comment section. And ask your questions, send us your thoughts and what kind of issues you want us to talk about this evening. And we'll make sure that we also share the Workers Action Center information so that you can reach out if you need to make a claim, for example. So as we kind of get into the discussion and start some of the questions, because we have some of the questions that were sent to us from constituents locally in advance. First, let's touch on why workers need to know their rights and how that can be helpful.
Why workers need to know their rights? Good question. I guess a lot of workers don't know their rights. Myself, like I actually worked for a major coffee chain for a week. I wouldn't name names, but I did work for a major coffee chain for a week in high school. And I was actually not paid for my entire week, which was on training. But now I realize that if you are in training and you're doing work, you need to be paid, right? So the very bare minimum stuff people don't actually know about, whether they are do not have access to the internet, proficiency in English language, or whatever. The first step about fighting for your rights is actually knowing your rights. And before working at a Workers Action Center, I'm not gonna lie, I just deleted my pay stub. I got my pay stub, I crushed it up, and I threw it away, and I'm just like, perfect. But now I realize how essential little things like documentation, pay stubs, contracts are in fighting for your rights. We get calls where it really breaks my heart when a worker says, I haven't been paid for 2 months, Jared, what can I do? And I'm like, all right, let's try to fix this. And they're like, do you know your employer's last name? No. Do you know the name of the company? No. I get a WhatsApp text once in a while and they tell me to show up. Then I ask them, like, do you see WhatsApp message work anymore? And it's like, no, they blocked me. And I'm like, Yeah. So it's super important to know your rights just to get the basics kind of thing. Yeah.
And so just a few months back, we had very similar cases that came into our office. And I know some of you who joined today may have been in these situations as well, where folks were working for large factories or laboratories here. And they started maybe 5 years ago, some 12, 15 years ago. And it's just been so long that they have been working in these positions, but have never actually kept documentation of when they started their employment. So it's so important for you to keep record of your employment, keep record of your pay stubs, keep record of any sort of disciplinary measures or any documentations that were given to you throughout the process, because that can be used against you sometimes and unfairly. And if you have those records, it's so much easier for those who are trying to support you, whether it's legal aid, whether it's Workers Action Center, to have those documentation. So make sure that keep your records.
Even little things like, they say stuff like, oh, I took photos of my timesheets. I took photos of the schedule, and then they lose their phone, right? Or they lose their text messages. So always keep backups of these things as well. So I would say document, document, document. And actually, it's okay to actually voice record a phone call, as long as you're one part of the conversation. So if it's you and your employer and you're worried that there's no witnesses, it's okay to actually voice record that phone call conversation. Just in terms of documentation, because some bad employers will always say, can I just talk to you in person? Can I just have a phone call? Because they don't want to write things down, because writing things down might get them in trouble. So just some tips.
And especially if you're in precarious situations where you don't have any. And during COVID-19, we found out there's a lot of people who have lost their jobs. Many women have lost their jobs because many women end up in being in precarious positions as well. So one of the questions we received, and I'll get right to it, and we have Maisha who's working in the back end and making sure that we have people's questions as they come in. She'll be sharing them with us as well. So the first question is, what do I do if I'm worried about COVID-19 safety at my workplace, but afraid to report it to authorities because I might get fired?
Yeah, so this is one thing that we are very aware of, where we have rights on paper, but exercising the rights is a whole different question. So on paper, workers have the right to know about, according to Occupational Health and Safety Act, we have the right to refuse unsafe work. But we do know and have experienced workers who say, I complained about health and safety in my workplace. We weren't provided a mask. We weren't provided PPE. And then they do get fired, right? So it's one thing to have the rights at work. It's another thing to know that on the ground, people are actually being terminated. It is illegal, and the employer is breaking the law if they are firing you because you're asking for your rights at work. Unfortunately, it's up to the worker to prove that that was a chain of events, right? So you can complain. And if they do terminate you, you need to show, I asked for my rights, I asked for protection, here's a written record of it. I talked to my supervisor said no. And I said, I cannot work in this work environment, and they terminated me. And then you can make a complaint at the Ministry of Labor. But it is a very difficult process if you really need that job and yet your life is at risk. So no easy solutions, in these kinds of situations. On paper, you're supposed to be protected, but in reality, the enforcement is very weak in a lot of cases. I would just say that before you do anything, feel free to give us a call. Feel free to give a call to your local legal clinic as well, because a lot of sometimes people do things without checking, and those things may result in bad consequences for them legally before they had, they didn't take the necessary steps, right? So rather than saying I'm refusing to work, they just don't show up to work, or they just say I quit, right? So there are steps you can do.
Yeah. And and I think there's a lot of people who are right now in a situation. I recently had a conversation with one essential worker who lives in the riding, works in the riding, and works in a chain institution or workplace that I'm unfortunately, she has asked not to disclose. So and she's worried right now. She's worried, and she's worried because she feels that she might get fired if she if the employer finds out that she's what she's feeling. And we have other workers who are now who are agency workers. So and they have asked questions about agency work in manufacturing plants. So the question is there anything that protects, so I'm an agency worker in a manufacturing plant. Is there anything that protects me from getting fired abruptly?
So to be clear, in Ontario, it's also another thing that we are very mad about, that there is no just cause protection. So basically, for almost any reason, workers can be terminated from their workplace. They don't need to give you a very specific reason. They can say stuff like we're restructuring or we're cutting costs, but they do need to follow certain things. So one, they cannot fire you if you're asking for your rights. They cannot fire you because you are asking for health and safety. They cannot fire you if they are discriminating specifically against you, like because of your gender, because of your ethnicity, because of your religion or your family status, for example. Um, and the other thing is you mentioned the word abruptly. So in Ontario, you can be fired as long as they give you sufficient notice. So notice starts after 3 months. So if you've been working in the same place for 3 months, they need to give you 1 week notice. And every year after that, 1 additional week. So if you've been working for 5 years, you would get 5 years notice, for example. Or if they're saying, pack up your stuff, you're not coming to work tomorrow, they would give you 5 weeks pay in lieu of notice. So it's either or combination of the two. So anything that protects you from being fired, the answer is no-ish. Like you can be fired, but they need to give you notice and they cannot fire you for exercising your rights. Some bad employers do say that they're firing you for bad reasons, though. Like if you're fired for something called willful misconduct, so you stole something, or you're purposely late, or you got into a fight, or they said that you argued with the manager or something, they will just say, "Oh, we're firing you because you did something wrong on purpose." In those situations, they're not supposed to fire you abruptly if they're lying about willful misconduct. Yeah, but if you are fired with cause on something that you actually did, they can fire you abruptly. We do have experiences where employers lie about it so that they don't need to give you termination notice or pay, though.
Yeah. And just to be clear, this is the important part is this is not to say that there are great employers who care for their employees. We've had local small businesses that tried so hard to keep their employees on payroll, for example, to support them. So it's not that all employees are good and all employers are bad. It's just that there are sometimes when you have a bad employer, here are what are the rights that you have, and it could be the other way around, and that's why these rights exist, and sometimes it's not sufficient enough rights to make sure that people are protected.
Right. So there are good employers and there are bad employers, and when it goes good, it goes really good, but when it goes bad, it can go really bad. So we want to make sure that workers are protected, especially those who are most and least likely to be able to protect themselves, right?
I mean, just recently we heard about Amazon in Brampton.
In Brampton, right?
Yeah.
So it's like a big employer. It's supposed to protect health and safety, but no, there's actually a huge COVID outbreak and they're not actually protecting the workers. So regardless of whether it's a small company or a big company or a big brand, they are workplace violations. And yeah.
And this is the key point. So it's been a year since the pandemic, and I find it very hard to believe that this place did not have an outbreak before. So after a year, the fact that they were ordered to have to ask their workers to quarantine because they were forced to do so. So this is a prime example of labor rights that were undermined because workers were feeling vulnerable in a congregate setting that were not protecting workers, and they did not want to come forward because they did not want to lose their jobs. And that is the primary worry when we talk about paid sick days, when we talk about workers being protected and having the ability to quarantine, to go and take those time off. is because so that they can make sure that they are not afraid of losing their jobs and their pay, and to be able to put food on the table. Um, yeah, it's a very strange time, and we need to be able to protect people the right way. The next question I have is also similar to this, which is, and it's so I've been laid off due to COVID as an agency worker. What options do I have? Can I ask my workplace for severance?
Yeah, so similar to the what I mentioned before, they can terminate you for any reason as long as they give you notice or termination or pay in lieu of notice. I would just add to this point is that when you mention the word severance, there is two different things here. A is the situation where you're working for a very large company with a large payroll of around like $2.5 million, and you've worked there for 5 or more years. So if you're working for a large company and they terminate you and you've worked there for 5+ years, you get both termination and severance pay. So when you're making a claim in the ministry, it's good to be clear between the two. And termination pay only maxes out at 8 weeks for 8 years, but severance can max out to, I think, 26 weeks. So if you've been working for a really long time, yes, you can ask for severance and termination pay. I would also say that if you were laid off due to COVID-19, make sure to check whether you qualify for employment insurance or the Canada Recovery benefit as well.
So when you say 8 weeks for 8 years, what does that mean?
So for every year that you work from the start date of your place, they need to give you 1 additional week notice or pay. So if I've worked for XYZ factory and I've stayed there since 2015, I've worked there for 6 years. If my boss says, Jared, you're fired, pack up your stuff, don't show up to work anymore, they need to give me 6 weeks pay or 6 weeks notice. That is my last day, basically. I would just say that one issue that has come up as well is there is a change to the ESA under this government around temporary layoffs. So typically, if you're not scheduled to work, they need to give you termination pay or termination notice. Because you're not scheduled to work, it's considered something called a temporary layoff. So you're on paper, you're still employed, but in practice, you're not being called in for any shifts. Right now, until July 3rd, 2021, if you're not called in, you're not considered laid off in some cases. So your employer does not need to give you your termination pay or termination notice right now under the government. So it's a complicated question. If they totally lay you off, some employers do give termination pay, but if you're temporarily laid off, where you're on paper still employed, but your hours have reduced even to 0, you can apply for EI and CRB, but you will not get termination pay or termination pay because of the changes under the Ford government.
And you mentioned CRB, so and some of the folks who are listening, and some we have had multiple questions in the office about this as well. Would people lose their I guess do people have to pay back their CERB?
Yeah, so there's 2 different things, right? So there's the CERB, which was last year, and then the CRB, which is this year. In both cases, if you're eligible for it, you don't have to pay it back. So if you are laid off or your hours have been reduced by 50%, or you need to take extended time off because of it, you don't have, and you're eligible, you don't have to pay it back. But there is a lot of worry right now. During tax period, it's March 1st. A lot of people are filing their taxes. I would just put a caveat that I'm not an accountant. I studied political science at the University of Toronto. But it's my understanding that for CERB, it's considered income. So if you're eligible for it, you don't have to pay it all back. You do need to pay taxes for it. They should have mailed you the tax slip for it, a T4E. But if you do have to pay it back, two things can happen. One, if you paid it back last year, you don't have to pay taxes on it. But if you are paying it back this year, you may be asked to pay taxes on it, which is annoying because you're paying it back and you're paying taxes on it. So tricky, but yeah. We don't think it's fair that, the people most in need are being put through this situation. And when the government started providing it, they're just apply, don't worry about it. And now a lot of folks are facing very difficult situations with it.
And
I would
yeah, go
I
ahead.
would just say that there are a number of free tax clinics available to help and answer these questions. Maybe Dolly can also share some local Scarborough tax clinics that are available.
Absolutely, yeah. We're working to figure out support for those who are filing their taxes and need an understanding or place to go to as well. So we'll if you need support, please do reach out to our office. And while you're actually talking about the support that people need as they deal with income loss or those who are on CERB or CRB, but are not able to keep up or don't have it anymore. The other thing that we have requested well, we had requested and then we proposed a bill in the House. And just this week we debated this bill, and unfortunately the government looks like they're going to vote it down, and we're going to be back in 2 weeks in the legislature to vote for this, in a week and a half actually, just a week. And that bill was to provide rent support, and it was one of my NDP colleagues, MPP Rima Burns McGowan, who proposed this bill, and it was to provide support for those who have lost their income, who are facing a difficult time, but need some support to pay their rent. And we know how difficult it has been for a lot of people across Scarborough Southwest, because it's pretty expensive to live. Housing has been expensive. Paying your mortgage has been expensive. A lot of people rent out their basements just to keep up with their rents, and share that cost. So that rent support was actually means a lot for our community, and means so much for people who are just trying to get by and put a roof on top of their head to be able to provide the support they need for their children. So if you are, if you are someone who's facing a difficult time and who needs that support, reach out to us or email the premier, email the Minister of Municipal Affairs, and let us know as well, and let us know your story and what you're facing, because that will help us push the government and so that they vote for this bill, because it is something that is to ask for immediate support. And because we know that not a lot of people did qualify for CERB, for example. Not a lot of people were able to continue. There was a lot of confusion as well, and some people are now feeling like they have to pay back. And I think during this tax season, people will be finding out where they are at. The next question is actually on that note of taking time off and being able to first it was getting tested for COVID, and now it's about vaccination. So a lot of people during the beginning of the pandemic found themselves in positions where they felt like they may have caught COVID, but did not have the ability to take time off and get tested. Also, in the beginning, we saw that the lineups at these places were, enormous. That meant that people were lining up for hours. Thankfully, we were able to push for more testing centers locally, and we did get some testing centers available, and we're doing the exact same thing for vaccines. And last night when we did the town hall on vaccines, you heard about the support that we're pushing for, the equity plan that I have proposed in the House, the motion for equitable amount of vaccine. So if you're working, if you're an essential worker, if you're in a situation where you you feel that you deserve to be getting vaccines right now and deserve to be in the priority list, whether it's a vulnerable citizen, whether it's an elderly, whether it's someone with a chronic illness, who has to go to work and are at risk. We are fighting for you, and we're going to continue fighting for you. And the motion that I have is exactly for that. Um, and when I'm back in the legislature, that's something that I'll be fighting for. So the question that we have is, for those who get paid hourly and need to take some time off for a COVID test, what should they do at a time like this? Or get a vaccine? What should they do?
Right. So I guess I would just separate the COVID testing and COVID vaccine part. So in terms of testing, I guess there's a difference between job protection and actually getting paid time off if you're paying hourly. So in terms of job protection, if you're getting COVID tests, I was a bit worried I was getting COVID because of like a cold over December. So I went to go get a test. And after the test, they gave me a form saying you're supposed to self-isolate for 3 days or until you get your test results back. So if you are advised to get tested and you are advised to stay isolated, your job is protected under the infectious disease emergency leave. So if you're testing and have to self-isolate, your job is protected. On the other hand, because during the time, in terms of paid sick days, folks do not have paid sick days. 60% of folks don't have paid sick days. You can only apply for the federal level Canada Recovery Sickness Benefit if you miss 50% of your work week. So let's say you're being paid hourly and you got a COVID test. You're working, like, say, Tuesday, Wednesday, Thursday. If you get your COVID test on Thursday and you're supposed to self-isolate for 3 days, Thursday, Friday, Saturday, Sunday, you are not missing half of your work week because you're only working Tuesday, Wednesday, Thursday. So, but if you took your test on Tuesday, maybe you can get it because you missed a week. So the Canada Recovery Sickness Benefit, while it's good first step for some folks to get income support, especially for those who work part-time hourly, a lot of people are not able to fully access it because of a requirement to get it 50% of your work week being lost, right? So if you take a COVID test on a Thursday and Friday and you're not working the weekend, you're not actually having your income supported. And that's very difficult for people who are working hourly and need every hour to actually make the rent at the end of the month.
And so for those who want to get tested, and let's say they have been asked to get tested, they are able to go out and get tested and then take the 2 days or the amount of time they should isolate right now under the provincial legislation.
Yeah. So the job is protected to take the time off, but in terms of income support, not so much. So it's, again, one of the situations where your rights on paper, but the ability to take it is limited by a lot of people because of their income and the lack of government income supports for it.
And in terms of the federal piece, for when you apply for the Canada Recovery Sickness Benefit, do you have to pre-apply to find out if you qualify, and how does that work? Because a lot of people are paycheck to paycheck. Are they able to find out in advance? What are some of the difficulties?
Yeah. So the other thing that we are much in favor of paid sick days at a provincial level is because the federal sickness benefit is you apply for it every week. At the end of the week, you see how it is, and then you maybe get it, you maybe not get it. And in comparison, if you're getting it as an employer provided paid sick day, you know it will show up on your next paycheck, right? And for a lot of folks where English is their second language, or you don't have access to the internet, and libraries aren't necessarily open for people to apply, it is very difficult for people to apply for the Canada Recovery Sickness Benefit. So there are a lot of barriers for it. And it doesn't matter how long you're working for too. So for the Canada Recovery Sickness Benefit, you need to have worked in the previous year up to a certain amount, versus for folks who just need to take a few days off this year, and they just started working, you would be able to qualify for paid sick day at provincial level if it was being legislated.
Yeah. And when it comes to vaccination, because you're not required to isolate, if you get vaccination, none of this applies.
Yeah, it should be something. I think everyone should get vaccinated. But again, if you can't take time off and you won't get paid to take a bit of time off to get the vaccine, it's going to be a barrier for a lot of people, you know?
And I think as the next phases of vaccinations roll out, this is going to be a tough time, a tough issue for a lot of people locally here. We know a lot of essential workers here who may not be able to figure out the time. And one of the things that we're working locally here with different community organizations, faith organizations, is to make sure that people are able to get vaccinated at different times of the day. So, for example, workers who work 9 to 5 jobs won't be able to take time off in between those hours. So, having the ability to go at a time before or after their work period. We also know that Ramadan is coming soon. So for the Muslim community that will be, fasting, that's, practicing, you should be able to go in and get vaccinated at a time when you're not fasting because of the certain regulation rules, while you're observing your fast. So we have made sure that people are aware of that. Our health network is aware of that. When I was, talking to some of our Scarborough Health or Toronto East Health, they are aware, and I'm hoping that we're going to have really good hours that can accommodate our local community to make sure that you have the ability to go out and get vaccinated. Jared, I want to go back a little bit and in the issue of paid sick days, because this week we actually had not this week. This week I had one of my colleagues propose this bill, the motion, but the week before I proposed it as well. Or maybe the week just feels really long, but I think it was earlier this week. But a few days ago, I had proposed paid sick days in the legislature, and unfortunately, the government voted down. And we've debated it as well as an opposition day motion, because we know how important paid sick days is. We know how essential it is to make sure that people have the ability to get paid sick days. And if we recall correctly, there were, right after the Ford government was elected, they took away the 2 paid sick days that did exist. And and I think a lot of workers actually found those 2 paid sick days, and even though it wasn't enough and it was legislated really late, that was something that was a good step that I think we went kind of backwards and eliminated those 2 paid sick days.
Yeah, it's weird that we have more paid sick days before the pandemic than during the pandemic, you know? It's pretty wild. And it's like, oh, they're like, they have this year, the Ford government is saying that the Canada Recovery Sickness Benefit is enough. Well, it's clearly not enough. Or they're saying good employers already provide paid sick days. Well, if only some people have access to it and some people don't, it's like some people peeing in a pool and saying it's okay to pee in a pool over here, but it still spreads to the rest of the pool, So unless we have rights for all and health for all, we don't have health for anyone. That's what I say.
Yeah. So as we're talking about this, some of the folks who are here wondering is what do we do then? If we don't have paid sick days, if we don't have the ability to take the time off for being sick, what options do I have?
Yeah. So technically, you do have. We used to have 10 emergency personal leave days to take sickness, for sickness, a family emergency, or whatever reason. Now, if you're sick and it's not COVID related and you can't take the infectious disease emergency leave, because that's only for COVID related reasons, we only have 3 unpaid sick leave days where your jobs are actually protected under the ESA. So basically, if you have like the flu, but it's not COVID, or I'm trying to think of like being sick without being gross, but if you're sick more than 3 days, you need to make the very difficult choice of deciding to go to work sick, getting other people sick, feeling really terrible, or staying home and not get paid, you know? And the other thing I just want to add on the paid sick day point is that right now, for not COVID related, for the normal paid sick days, for the normal unpaid sick days, you actually need to get a doctor's note for it. So let's say, I sprained my wrist or something, and I can't go to work and carry boxes and stuff. The employer is allowed to ask reasonable evidence, including a sick note. So not only do I not get paid for not going to work, I need to fork out money out of my pocket, pay a doctor, spend a couple hours in my family doctor or a hospital instead of getting better. So I
And
say no paid sick note, no sick notes, paid sick days, and paid sick days for everyone.
yeah, and just to clarify, it's that's a very important point that Jared just raised. When you go to the family doctor, for example, and ask for a sick note, you have to pay them. And it goes from $30, for example, to $60, $70. So it depends on which location you're at, what family doctor you have, and if they will agree to give you one, if and how much you're able to pay, because we're talking about essential workers who are getting minimum wage pay, for example, people who are working hour to hour, people who have precarious jobs are working multiple jobs to make ends meet, and here we are forcing them to go and to get paid sick days, get a note and pay for that. I think that's a shame. I think we have to do better, especially by these workers who are having a tough time just to keep up with the amount of jobs they're doing, and to live an affordable life in these communities. We
It's a
have a
lot.
go ahead.
Oh, I'm just going to say it's a lot of mixed messaging from the government, right? So it's like, stay home if you're sick. Don't leave the house, right? We're under lockdown. And then it's like, actually, so many people are essential workers who have to take transit and have to go to work. So they can't stay home because they don't have the ability to for a lot of frontline workers jobs, such as food service, food processing, Amazon factory workers. And then for those that do have to go, they say, stay home if you're sick. But if you don't have paid sick days, you actually can't. So it's a lot of, here are your rights, here's what you should do, but we won't allow any support to actually allow you to do it, right? And they say, why is the numbers going up?
Yeah. Yeah, absolutely. Thank you for that. I have another question that just came in, that I want to ask Jared, which is about migrant workers. And we know they were facing during COVID-19. So someone just asked on one of our social media outlets, what rights do migrant workers have when it comes to COVID-19?
Yeah, so in general, we work with a lot of migrant workers. Some of them on work permits, some of them don't have any work permits who are still working. And it's definitely a very scary situation around who gets the vaccine and who doesn't get the vaccine kind of thing. It is also a very scary situation, for example, for folks, we mentioned at the start, what do you do if you're a migrant worker? What do you do if you're a worker and you're afraid to make a report around health and safety? If you're a permanent resident or a citizen and you make a complaint and you get fired, find another job. If, for example, you're a live-in caregiver who is taking care of a family and your permanent residency application is dependent on you staying in a job for 2 years, even if you're being abused, even if there's health and safety things, it is very difficult to actually advocate for your rights. If your rights as a migrant worker are tied to your employment and your immigration status, you don't actually get it. So we are actually supportive to change the rules around it for permanent residency status for migrant workers. If you're good enough and essential enough to do the work, you should be protected. And you can't actually exercise your employment rights without guaranteeing your status in Canada.
Yeah.
The vaccine question is still a big question. I do say vaccines for all,
Yeah.
Especially they have been saying that getting the vaccine doesn't mean you still can't transmitted. They're not even too sure about that, right? And getting a vaccine doesn't even mean that you're fully immune. It would just lower the effects. So everyone should get it regardless.
I agree, and I think it's also there's also an economical and a social argument to it, a public health argument to it as well, because we were relying on migrant workers during the height of this pandemic, in terms of our food supply, making sure that people are able to have the food chain going, the entire industry. And I remember my colleague from Timiskaming Cochrane, for example, John Bantoff, or from Essex, Taras Nadashak, all of them were firsthand working with migrant workers who have reached out to their offices, because they were in situations where they were unsafe in workplaces. They were not able to isolate, not just in workplaces, but in their living arrangements. From beds to shower, all of that arrangement is a scary place. And then what did you see? We saw large outbreaks. Now we know where our food's coming from. These a lot of these workers, for example, if they are an essential part of that chain, we have to make sure they're protected. And that goes from whether it's testing to be able to be in a safe workplace, to be able to get vaccinated. So if we want the economy to keep running, if we want to be able to have, do the right thing, really, to be able to make sure that there is not a lot of not outbreaks, to protect each other and our communities, and the fact that we want food on the table and protect ourselves and to simply do the right thing, that's, I think it matters, making sure that everybody is able to have good health, have access to good health. It's such an important part of our lives. Um, yeah, that goes for the entire province and all of those people who are waiting to be vaccinated. And trust me, when we talk about the official opposition, this is something that we're going to be fighting for. Jared, we're really cutting close to 7 o'clock. So I want to see what questions that I have left, and ask you those questions before you leave. Maisha, is there anything else that you have on our social media? But I want to take a moment to give you a chance to talk about, what are some of the things that we can do in terms of protecting our workplaces, making sure people are able to speak out. How can they speak out? Whether it's remaining anonymous, and why it matters in terms of their job protection, job security, and simply protecting our workforce. A lot of people who are in these situations are vulnerable workers, immigrant workers, a lot of women in these workplaces. We just celebrated International Women's Day, and we know that a lot of people who have lost their jobs are women. Where despite the fact that over 50% of our workforce is women. So what we're facing right now, and what is it, around more than 80,000 people across this province that have lost their jobs. So if we're looking at protection, security, and workplace security, what are some of the recommendations you would make, and what are some of the advice you would give to workers, and as you kind of wrap up?
Yeah, so we just mentioned, like, I think it's so hypocritical when politicians and companies be like, we celebrate International Women's Day, and then they don't actually support or legislate or provide their workers paid sick days when women are disproportionately impacted because they're working lower wage work without paid sick days. Same with Black History Month, same with supporting migrants and everything. You can say one thing, you can call essential workers heroes, but then on practice, a lot of places, a lot of companies are actually treating workers as expendable, right? So two things. One, if you are a worker facing problems at work, feel free to give us a call at the Workers Action Center. I hope Maisha is on the social media chat, but you can throw in the phone number and the email and our website there. As well as, so we have a hotline, entirely confidential. We're not part of the government. We're not part of the government for sure, Aziz. So we keep things entirely confidential. And you can call us any step of the way, whether you're not sure about your rights or you're about to do something and you're not sure whether what you should do or after your right has been violated. So please give us a call. But on a systemic level, especially, we know that as much as we help folks and empower them by individual to individual, one-on-one, things need to change systematically. So I would suggest folks contact the Decent Work and Health Network, who are supporters of paid sick days and around, the social determinants of health. We can't have decent work. We can't have decent health without decent work. We can't have decent health without decent work. So check out the Decent Work and Health Network to push for paid sick days and such. And March 23rd is also a 15 in Fairness meeting, a monthly 15 in Fairness meeting online where we organize and strategize across Ontario to push for changes. So those are the things that I would suggest.
And where can they find information about that?
I wish I could see the chat. I should have brought a second laptop, but 15infairness.org/events would be for the next event. Folks on Facebook can just type 15infairness. Fight fair wages now, 15 in fairness, to go and check it out as well.
Perfect.
Yeah, I'll be there.
And we'll make sure to put it on our social media as well, so that for folks who weren't able to catch that, we'll make sure to put that on our comment section on our Facebook Live. That's also getting it, and put all the other contact information that Jared gave, so that you can contact them if you want to share, your story, share what you're going through, or need any support, who you can reach out. So we'll make sure to share that as well. And always feel free to reach out to our office if you have any questions, comments, or if you're facing a difficult time in your workplace, or if there's an outbreak that you want to talk about, if you need an inspector to go in your workplace and are worried about speaking out and are worried about being reprimanded. Please don't hesitate to reach out to my team. They're working incredibly hard, especially during this time. My team is working so hard, whether it's vaccine rollout, information sharing, putting everything together, and the whole guidelines, to protecting workers and providing information for them. So do not hesitate to reach out to my office. Jared, thank you so very much for joining me today. Jared from the Workers Action Center, doing incredible work, protecting workers every single day. And I'm so proud of the work that all of you guys do. I'm grateful to have an incredible team fighting for us, especially workers who are struggling during this time. Thank you so much. And thank you to all of you who joined us today. It's always an honor to serve the great people of Scarborough Southwest. We'll be back again with another session, another town hall, another important issue. If there is something that you want us to talk about, please let us know by contacting our office. Thank you so much and have a wonderful weekend. Thank you, Jared, for joining me on a Friday night, and to all of you who joined us on a Friday night. Take care.